Dear student, today I want to discuss about the hemodynamic systems of you, especially the topics edema is very important when you go to the clinics, when you go to the hospital, when you see the patients. What you see? First you identify the problem, what is edema. I am Moinuddin Chisty. So, firstly I want to discuss the edema. You see the pictures in the legs and in the hands. Just you compare the two comparing pictures. One edema, when you press by the finger, then it becomes a pitting effect. So, we called it a pitting edema. So why you called it pitting edema? Mention it pitting edema, there is some other edema also, the non-pitting edema. So, before defining the what is pitting edema and what is non-pitting edema, so we have to know the what is edema. So, that several term is used to define the edema, but what you understand and most of the examiner will accept what is edema, then abnormal amount of fluid within the tissue space and or body cavities. So, if the abnormal accumulation of fluid within the tissue space, it is also called edema. When it is abnormal accumulation of fluid within the body cavities, it is also called. So, both not required simultaneously. And next, another is important, you must know the edematous fluid, whether it is exudative or transudative. So, when exudates occurs and when transudate occurs, you must know. So, before going to the how edema occurs, the what is exudates? The fluid which is rich in protein, that is having higher specific gravity is more than 1020, and these exudatives may be due to increased vascular permeability. Where occurs? Usually in inflammation the exudate occurs. Transudates, it is a fluid in low protein in nature, low protein content and specific gravity having about 1012. I told you that exudate occurs when there is an inflammation. What happened? Increased vascular permeability. But in case of transudates, it is a non-inflammatory fluids. So, why it occurs? That is due to imbalance of pressure factors. So, what are the pressure factors? First we see the normal things in the graph. You see this is a capillary beds, and this capillary beds is this one the arterial ends, and here is the venous ends. In case of normal, the capillary hydrostatic pressure in the arterial end of capillary is about 32 millimeter of mercury here. But in case of venous end, it is about 12 millimeter of mercury. So, the difference is here is 32 and here is 12. So, more than 20 millimeter of mercury the capillary hydrostatic pressure differ. So, not only the factor which causes leakage of the fluids. Other factors also involve the colloidal osmotic pressures. Who exert it? The plasma protein exert colloidal osmotic pressure, especially the albumin fractions of plasma protein. And colloidal osmotic pressure is about 25 millimeter of mercury. So, what happened? Normally, in the capillary end, there is some fluid is leaking, and this leaking fluid is reabsorbed in the venous end. So, there is no edematous fluid or no abnormal fluid accumulations in the interstitial space in case of normal. What happened in case of inflammation? So, the difference is, you must understand this figure. Here the capillary hydrostatic pressure is almost similar, and capillary hydrostatic pressure of the colloidal, that is venous end, is also similar previous in case of normal. So, why there is edematous fluid, inflammations, excess fluid accumulation? So, there is a decreased colloidal osmotic pressures. Normally, capillary hydrostatic pressure forces out of fluid from the vessels to the interstitial space. What is the nature of the colloidal osmotic pressures? Colloidal osmotic pressure tends to retain the fluid within the vessels. So, colloidal osmotic pressure is 25, capillary hydrostatic pressure is 32. So, the difference is 7 millimeter of mercury. So, excess fluid leaches out, but here the colloidal osmotic pressure is less than 20. Normally, it was about 25 millimeter of mercury. So, maximum fluid out from the vessels, and in the venous end the same, the capillary hydrostatic pressure is low, 12, but the colloidal osmotic pressure is also low. So, fails to reabsorb the fluid from the interstitial tissue space. So, next, the mechanism of fluid balance. So, why this occurs? First of all is very important, the permeability of the vascular endothelium. Why? Vascular endothelium is a semi-permeable membranes. It allows water and crystalloid to pass through it freely, but very little amount of protein is permitted to pass through these semi-permeable membranes. What happened in inflammation? The permeability of the vessels is increased, so it allows excess fluid in the interstitial space in case of inflammations. Second factor is involved is hydrostatic pressure of the blood vessels. Capillary hydrostatic pressures, it also forces out the fluid from the capillary wall into the interstitial space. Another factor is the oncotic pressure of the plasma. It is about 25 millimeter of mercury and depends largely on the albumin fractions of plasma protein, and it tries to retain the fluid within the vessels. So, the hydrostatic pressure and oncotic pressures of the interstitial fluid are low and counterbalances each others, and hydrostatic pressures in the interstitial fluid about 3 to 4 millimeter of mercury. So, little play factor in the formation of edema. Another factor is important, the concentration of the intravascular and interstitial fluid, concentration of sodium is also important in the formation of edema. And sixth number factor is normally drain the some of the intravascular fluid and protein into the blood by the lymphatics. So, if the lymphatic is obstructed, then there may also occurs in the edema. So, the most important two factors, capillary hydrostatic pressure in the vessels and colloidal osmotic pressures of the vessels is important in the formation of the edema. If the capillary hydrostatic pressure is increased and colloidal osmotic pressure is decreased, so these two factors plays an effective role in the interchange of fluids. So, the pathophysiology of edema, how it occurs. And now, the next sessions I will discuss about the pathophysiological classification of edema categorically. Thank you to you all for today.